it's almost as though we've been kind of broken mentally and we've not yet had the time to sort of rehabilitate from that unfortunate event.
Coping with multiple global crises, from wildfires to protests and wars in quick succession, has left many feeling burnt out. A mental health expert says all the upheaval against the background of the already disastrous COVID-19 pandemic is pushing people to their breaking points.
If you were to break your leg or your arm, it wouldn't be that immediately you could go back to using that limb without a sense of rehabilitation. And we haven't yet had that chance to even pause and take a breath before a lot of these other types of events.
A survey conducted by the Centre for Addiction and Mental Health in January shows that feelings of anxiety, depression and loneliness in Canadians has spiked to the highest levels since spring of 2020, when the pandemic began. Sociologist Dr. Marissa Young says multiple stress factors have added up, especially since most of them are world events that are out of our control. She says one of the first steps towards recovery is to reclaim that very thing.
In order to try to regain that sense of control or really psychological mastery, take a reflective pause on things that you can and cannot control, right? And draw on those smaller things or smaller events where we can take back control.
Dr. Young says the end of provincial masking mandates is a good example.
Now you have no control over whether you go to a place indoors and feel comfortable or not with others not wearing masks. And unfortunately, the only control that we can have is wearing a mask if we feel we want to wear a mask, right? And so those are the things that we really have to grab onto and recognize.
She adds, emerging from more than 2 years of seclusion or distancing and rejoining communities goes a long way in rebuilding or strengthening mental health.
Things have opened up. We are, lifting all the mandates, and so engage with those communities. And I think especially with the conversations that are being had, rather than isolating oneself to watching the news and seeing all of the devastating images and circumstances, to reconnect with individuals, even if you are still talking about those certain events, you're doing it with others, and there's a sense of comfort there.
Another oft-repeated but necessary piece of advice from Dr. Young: try to find a balance between staying informed and engaged and doom scrolling. If you don't have to be in the know 24/7 like some of us in the news biz, put your phone down and go do something else. For more on this story, you can go to our website, citynews.ca. For City News, I'm Dilshad Burman.